Anton Tran. My name is Dr. Ngo. Nice to see you today.
Nice to meet you.
Alright, today I asked you to come in to do a physical assessment. Is that alright?
Yes.
The first thing I'm going to do is wash my hands. Alright, may I begin touching you?
Yes, ma'am.
Okay. The first thing I'm going to do is take your temperature. I need you to put this under your tongue for about 30 seconds. Your temperature reads 96.1 degrees Fahrenheit, which is the same thing as 35.6 degrees Celsius. The next thing I'm going to do is check your pulse. So you don't mind giving me your arm, I'm going to measure your pulse coming from your thumb to your radial artery using these two fingers. Alright. Within those 30 seconds, I counted 48 beats within those 30 seconds, which is the same as 96 beats per minute. And at that same time, I calculated your respiratory rate. Within those 30 seconds, I counted 6 breaths, which is the same thing as 12 breaths per minute, which are both in the normal range. Alright, the next thing I'm going to do is calculate your BMI. So the first thing I'm going to do is calculate your height. Can you please step down and step on this device for me? You can step off for me. Thank you. I measured 5 feet 8 inches, which is calculated to be 68 inches. That's also the same as 172.72 centimeters. Alright, now I'm going to ask you about your weight. When was the last time you weighed yourself and how much weight?
I was 212 and it was about 2 weeks ago.
Alright. 212 pounds is the same thing as 96.3 kilograms. Just give me a moment, I'm going to calculate your BMI. Alright, your BMI is calculated to be 32.3, which is a little above the normal range, so it's slightly overweight, but I would just advise you to be cautious with what you're eating. Just exercise regularly if you don't, and other than that, you should be fine. If you're really concerned, you can see a nutritionist. And to further assess your health today, I'm going to check your elbow breadth and your skin fold thickness. And I'm going to begin by doing the elbow breadth measurement. If you don't mind standing up for me, please. This is going to measure your body frame, so please face the wall, put your hand up, palm facing that way. We're going to measure the area between your lateral and medial upper condyles. I measured it to be 70 millimeters, which indicates that you are a medium body frame. The next thing I'm going to do is measure your skin fold thickness, which is going to tell me your fat percentage. So if you don't mind standing for me the same way, I'm going to measure your arm distance right here. Using this, I'm going to measure from the top of your scalpel down to your elbow. I'm going to find the midpoint of that. And from this point, I'm going to measure skin fold thickness. Gonna pinch in the back a little bit. I'm gonna use the same device to measure, and I'm gonna pinch 3 times. All right, thank you. You can take a seat. I calculated an average of 20.9 millimeters, which is indicating that you have 24.5% body fat. I'm done with my assessment today. Are there any questions?
Oh, man.
All right, thank you. Hope you have a great day.